Hello, my name's Ashley Rodriguez, and I'm going to show you an NG insertion. Um, for starters, I'm going to check my orders. I'm going to make sure I have a doctor's order for the NG tube with the proper indication. So I've done that, checked my orders. I then am going to gather supplies, which for today I already have. I have my NG tube, I have an emesis base, and I have tape, gloves, lubricant, tissues, a cup of water, safety pin. So I've gathered everything that I need. If I didn't say gloves, I have those. And then I'm going to go into the room. I'm going to wash my hands as I go into the room. After I've done that, I'm going to identify the patient using two identifiers, normally name and date of birth. I'm going to provide privacy, especially if this is a two-person room, by pulling a curtain or shutting a door. I'm then going to explain to the patient who I've identified. I've also introduced myself to him. I'm going to explain the procedure. Today you're getting an NG tube. Doctor has ordered one for whatever which reason. We're going to, insert the NG tube. It goes through your nose. And then once I've fully explained it, I'm going to check to see if the patient is comfortable. If he's comfortable, understands, agrees that yes, we're going to place this tube in his nose. Once I've done all that, the patient is safe, comfortable, I'm going to raise the bed up into high fallers so that it's a better position for me, as well as for the patient to get this placement done quickly and efficiently. I'm then going to inspect the nose, check each nostril, see which one has better airflow. For today, we're going to use the right side because it does have greater airflow. I would use a pen light. I don't have my pen light on me today, so we're just going to pretend pen light here. I've checked the nostril. I then would measure with the tube from the tip of the nose to the tip of the ear down to the tip of the xiphoid process. Once I've done that, I would mark the tube, which I've already marked the tube today. However, considering this is just a head, obviously we don't have all of that to do, as well as it won't go down as far. So everything is set up, ready to go. I have my patient here, and we're going to get started. We're going to put a towel on his chest. This is his chest. Get our tubing, get everything ready and prepared. I am going to lubricate the tube, whether it be with water. Hot water works to kind of soften the tip of the tube, make sure it goes down, easier. Also lubricant. So I have lubricant today. Here, I'm going to lubricate the tip of this. I also have a cup of water for the patient that I would give, and if the patient is capable, then I would ask them to tuck their chin down like this and take small sips as we inserted this tube. So with his head tucked down, chin to the chest, I would ask him to take small sips and swallow as I inserted the tube into his nose. And every time that he swallows, I would be able to insert about 5 to 10 centimeters, depending on, what he tolerated. So we're going to insert this tube, insert, all the way to where we marked, which you can see right here is marked. So tube is in now, and we're going to check on placement. We're going to, hold this in his nose. We're going to aspirate at the end here and check to see what the pH is. And once he, I would have a pH test strip. I would test the pH of it to see if it was in the right place. If the pH was between 1 and 4, I would know that it was likely gastric and was in the right placement. would then take a piece of tape, or depending on the facility, some facilities have nose straps that tape right to the tube and tape to the nose. But in this instance, obviously we have tape, so that's what we're going to use. It is taped to his nose. It's nice and secure, snug. Then I would also put another piece of tape down here and then take my safety pin and pin it to his shirt so that, the rest of the tube didn't get pulled on, kinked, or any of the sorts. Once I've done that, it's now in. I asked him to tuck his chin, swallow with every insertion. I've checked the placement with pH strip. It's attached to his nose. At this point, I would go ahead and lower his bed and put it back in the lowest lock position. Head could still be elevated for comfort. Whatever was best for him, give him his call light, make sure he was comfortable. I would then go let the x-ray know, since we have an order for x-ray placement, that we're done. It could be x-rayed. X-ray can come in, we can verify placement. And then after that, we're going to, so now that the NG tube is verified by x-ray placement, we would, hook them up to whatever tube feed, whether this be a continuous tube feed or a push every, however often. Regardless, even if he's continuous, we're still going to check to make sure it has proper placement, function, every 4 to 6 hours, depending on MD orders. Make sure that there's no complications, anything going wrong. At that point, we are good. Patient is hooked up to the continuous tube feed once they're hooked up and everything's good. Gloves removed, washed my hands again since I took gloves off. Patient is comfortable, is safe, call lights within reach, personal belongings are within reach. Bed is locked in low position. Head of the bed is 30 to 45 degrees for, aspiration risk. Anytime with NG tube, if your bed is flat, you can go ahead and aspirate the fluids that are then going back in. Once I've done all that, I'm going to exit the room and obviously go document, because if you didn't document, it didn't happen. I would document how the patient, verbally understood the procedure, they tolerated it well, the length of the tube, so what marking is on the tube, that way any other nurse can go back, review the documentation, see, see where the tube should be, where it was placed with proper function, proper placement. That way, if the length is different, they could be checking that. Also document the pH levels, x-ray was verified, patient tolerating well, whatever tube feed is running, whether it be Glycerna or, whichever other one, that would have to be documented, what rate. Yeah, that is placement of an NG tube. Thank you.